Hi, welcome to Viewpoint. I'm your host, Lily Newman, and my co-host, Susan Solomon, the Executive Director of Drug Crisis in Our Backyard, will be joining us next time. Viewpoint's mission, we started it to bring people information about resources that are in the community. Families face different issues and don't know where to go. And we do this by bringing you guests that are on the front lines that can help answer your questions. And today's guests are Michele Hennessey from Arms Acres, the Regional Coordinator. We have Dr. Rowe, Medical Director of Outpatient Services for Arms Acres in Carmel. And we have Steve Witte, Clinical Director of Outpatient Services here at Arms Acres in Carmel.
Correct.
Welcome. Thank you for being here with us.
Thanks for having us.
Thank you. So tell me, there's so much going on. Let's talk about the opiate epidemic and how it's just taken over our country. Tell us, how at Arms Acres, the outpatient services, are you addressing that and just addiction in general?
Well, we've opened up the only methadone program in Putnam County. As of December 30th, we moved into this new location, and we got approval from the DEA and from the state to open up this OTP, which is Opiate Treatment Program. Mm-hmm. We began operations on June 30th of 2017. And we're providing methadone and Suboxone and Vivitrol to patients who require that medication to help them with their addictions.
So that is, Dr. Rowe, medication, as we hear a lot about medication-assisted treatment, MAT, for opiates, people that suffer from, heroin, opiates. Mm-hmm. And that's what that is, the three choices.
Correct.
Because at one time, many years ago, Dr. Rowe, what was the choice that people had if you're on opiates?
Methadone was the only choice for many years. About 10, perhaps a few more years ago, Suboxone, which is now available in many forms under many different names, which is also an opiate, but which can be prescribed by doctors from their office for patients to pick up at their pharmacy and take it at home, as opposed to a methadone clinic, where patients come every morning or almost every morning to obtain their medication.
Could you explain what they do, the methadone, Suboxone, Vivitrol?
Well, we'll try to take the first two, Suboxone and methadone, are in fact opiate medications, and they replace the opiates that patients are abusing by not being able to obtain them in a medically controlled and appropriately regulated setting. Okay. What many people don't understand about opiate addiction is that once someone is taking any opiate for an extended period of time, they begin to warp the structure of the brain cells in such a way that they don't necessarily go back to normal functioning, at least not for a very long period of time. And so that makes it very difficult for the person to function without an opiate in their system. They not only don't feel normal, they often feel quite sick. A sickness similar to what many of us have experienced when we've had the flu. And that can be a very severe flu-like syndrome. Sometimes it's not so severe, sometimes it's just an intense craving, as if you hadn't had a drink of water for 2 days and you were dying for a glass of water.
Right. So when you talk about Vivitrol, what's the difference between Vivitrol and Suboxone and methadone?
Vivitrol is not an opiate, it's an opiate blocker.
Okay.
And so when the Vivitrol is injected, it lasts about a month. And if a person were to use any opiates when they have the Vivitrol in their system, they would in general not feel any effect from that opiate. And so they're much less likely to obtain illegal opiates. And if they do obtain an illegal opiate, they won't get much effect when they use it. So that really helps a person accept the fact that they are going to remain abstinent. It's much easier for them to participate than in an outpatient program such as ours, where they can acquire the skills and the support to refrain from seeking illegal opiates.
And then, Steve, come to you, which you run the outpatient program here.
Yes.
When we talk about that, it rewires the brain or does something to the structure of changes the structure of the brain. Is that why it seems to take so much longer for people to get sober or recovery from opiates.
Well, the recovery process, what
Help.
Dr. Rowe described, the medication issues, our program is different in that we will prescribe medication like methadone or Suboxone or Vivitrol, but we require patients to attend group as well. So it's medication for the addiction, and it's group therapy to help them change their behaviors
Right.
in life to become free of groups that may get them to use again and relapse again, to develop sober supports, to attend self-help in the community, to resolve any legal issues they may have or any family issues that they may have. So many methadone programs in the past have just provided the methadone.
That's right.
But they have not provided the treatment in
Right.
addition to that.
Right.
And we are trying to change that culture and involve people in group therapy on a regular basis.
Now, there's some doctors out there that just prescribe the Suboxone and or the Vivitrol, and I believe it's supposed to go, like you said, hand in hand with treatment. So how do you address doctors that just give the Suboxone, client comes in, gets the prescription, and then leaves, and really no treatment?
Well, we can't prescribe how other physicians would do that.
Right.
What we can do is provide an alternative. And what we do have patients who attend our group and who also get their Suboxone at other locations.
Okay.
And so we coordinate care
Got it.
with those doctors. We let them know what we're doing, and we ask them what they're doing, and hopefully through that coordination, we can provide the best treatment for those people.
And I guess that's the answer, because you're coordinating with the doctors who just give Suboxone to let them know it's got to be both.
That's correct.
And a lot of doctors might not realize that to be successful, you have to do both.
But it's not just for those medications.
Right.
A lot of patients, they may get oxycodone or other medications like that, Klonopin or Xanax.
Right.
So we coordinate care with those physicians as well
Right.
to be sure they're not overprescribing, and so we can help those patients withdraw from those medications in a safe way.
Got it. Thank you. And Michelle, what do you do? And I know what you do, but tell us what you do, Ms. Smiley.
I work in the community. I'm a social worker, and I work in the community, as does a larger team of regional coordinators. And I cover Westchester County, but I have counterparts that cover Putnam and Ulster and Rockland and Sullivan and Dutchess. So we are out pretty much every day in the communities working with individuals, working with families, working with outpatient programs, working with doctors, everything you could think of. I like to say I wear flat shoes because I do a lot of running around.
That's right.
Yeah, so
And we won't talk about my heels. Go on.
So we're out there, and we just really want to be available as a resource to these different entities and individuals and their families, and also to just welcome them to come and meet with us, take a tour, Arms Acres, inpatient, outpatient. We're there to help them in any way that we can.
Now, you talked about being one of the only methadone, medication-assisted treatments that also has mandatory treatment attached to it. It's just not pick up your medication and go.
Correct. Up to now, methadone has been available in Westchester County,
Right.
in Dutchess County, in Rockland, but not in Putnam County. We are the only methadone
I didn't realize
program
that.
in Putnam County.
Oh, I didn't realize that.
And to that point,
Yes, please.
I cover Westchester, and I've been visiting a lot of the different programs throughout Westchester County, and have been hearing over and over how there are people that are coming from these areas up here and traveling quite a distance to get down to methadone programs. So this has been a really wonderful thing to allow people the ability to access treatment closer to their home in
Right.
their community.
Right.
So we're really proud of that.
Because they'd have to go down to the Bronx or...
or South Yonkers or wherever, and some people have been traveling quite a distance to get to these programs.
And many of those programs have waiting lists, and so
Right.
people who need methadone apply to those programs, and they're told they need to wait 6 months, sometimes a year, to be able to get their methadone. So that's why we're getting a lot of people from out of county, as well as many Putnam residents.
And you can take out of county,
Yes.
right?
Yes.
Now, the insurance pays for the 3
Yes,
medication-assisted
they do.
treatment? Medicaid and all insurance companies
Yes.
now.
Yes.
Okay. What about Vivitrol? Because I know that's expensive. How has that come down in price for patients? I know, Michelle, anyone?
Actually, for most of the patients that I've treated with Vivitrol, it's a nominal copay.
Is it? Okay.
The shot the injection that's given once a month is over $1,000.
I know.
And most of that is absorbed by insurance.
Really? Thank God. To
Yes,
open
indeed.
this up so that people that are suffering from this disease, especially the opiates. How long is treatment? I know it depends on the individual, but at Arms Acres, the outpatient program, how long does someone stay?
Well, we want to be
average?
sure that when a patient is discharged, that they are safe, so that all the risks that would get them to relapse are minimized as much as possible. And so treatment can last quite a long time until we know they're safe. Now, the other factor is insurance. How long will insurance pay for their treatment? And so that's always something we're fighting against as well, trying to make sure we get approval for additional treatment. Methadone is relatively cheap, and so people can be on methadone for quite some time. And that's why our program is different, because we are actively trying to help people adjust their lives so that they don't have to be on methadone forever.
Right.
But people have been on methadone for extended periods of time.
They have. So because you're clinic level, do you want to just talk about the services? Your
Sure.
clinic.
Well, we have two levels of care.
Okay.
One is called IOP, intensive outpatient, and that is a 3-hour program per day. And so if a person is not working or not going to school and is available during the day, and their level of need in terms of their use is high, they'll be in intensive outpatient 5 days a week from 9 o'clock in the morning until 12 noon, Monday through Friday. If they're working or they have travel problems or family problems and they can't come during the day, we have an evening IOP program that runs Tuesdays, Wednesdays, and Thursdays from 6:30 p.m. until 9:30 p.m. Once they finish the IOP level and they move into a lower level of care, which is called clinic service, that's a 1 hour a day group, and it runs 3 days a week. And we have multiple opportunities. We have one group that runs Monday, Wednesdays, and Fridays at 8 to 9. Another that runs Tuesday, Thursday, and Saturday, 8 to 9. Then another round of group as well at 11 o'clock.
Okay.
And then a third one at 6 o'clock in the evenings. So we try to provide opportunities for people who have busy lives to come at all times of the day and evening.
Because recovery is about incorporating the real world into treatment and not saying to people, well, quit your job, leave your apartment, come inpatient. I mean, people have lives and real needs out there, and it sounds like you're very attentive and open to that.
Now, in addition, our staff provides individual sessions for all patients at least once a month. Frequently, it's much more frequent than that. But we do try to provide individualized treatment in addition to the group treatment for all our patients.
Now, I don't know if you know, I'm just going to ask, what about if a person's homeless? What's up in Putnam for people that are homeless? I'm just wondering.
There is not much,
Okay.
and we struggle with that because we do have a number of patients who have no home to speak of,
Right.
or they've been evicted from a home, or they've gone through a divorce and one spouse has taken the
Right.
residence and the other is without. So we struggle to find opportunities for them. There's a program called Search for Change, which provides housing, and it's a very good program. The people in Search for Change, they may need to have some psychiatric diagnosis, like depression or something like that, but they can be living in support apartments for a long period of time.
And Dr. Rowe, you've been doing this a long time. How has the landscape changed with this addiction?
Well, I think we've come to realize that patients in recovery from opiate addiction in particular need medically assisted treatment.
That's right.
And in the past, the prognosis for these patients, if they've gone to a detox, have come out of a detox and usually relapsed within a matter of days.
Right.
So now there's real new hope for patients with the new medications that we have. So it's a much more optimistic field to be in than it was several years ago.
Yeah, you're right. And how long can a person stay on Suboxone or Vivitrol? Is there a limit?
Well, Vivitrol, generally, we see patients on for 6 months to a year. Some patients elect to stay on it longer.
Okay.
As far as Suboxone and Methadone, anywhere from a few months to a few years, sometimes a lifetime.
Okay.
I've had
Whatever
patients
works.
in my practice for 30 years who have
Wow.
done extremely well staying on Suboxone-type medication for all those years.
And whatever works, you know. You know, you have a handout for Arms Acres. Do you want to just talk about it and show it to the audience, please?
Yeah, so there's two things coming up. This is just a flyer about the program here.
A little lower.
In Carmel. Oops,
There
a little
you go.
lower. And it's Old Route 6, so it's a new location for us. We moved into the community, as Steve had just said. So,
And it's on opiate treatment program, right?
so it's the opiate treatment program and the clinic services. It's all under the same roof. It's all in the same space.
Is it going to be here next door, or is it going to? Oh, it's going to be next door.
Exactly.
Okay, I thought it was at the 75, whatever, Seminary Road.
No, so
it's
actually, right. So the outpatient came out of 75 Seminary Hill Road, and then now we have it here.
Could you talk? What is that going to be? A
So
forum?
this is a flyer just about the outpatient program, but also too, I would also just want to make mention of the fact that on Monday, November 6th, we're also going to be having an open house. So although the opiate treatment program and the clinic services has been in existence now for some time, we felt that it was important to really let people know and get the word out as much as we can. We've been diligently trying to get the word out, and we are so thankful that you allowed us to come on the show, so that will help in that endeavor. So thank you very much for that. And also too, just as far as just, you know, letting people know that if they are interested in coming to the open house, that they should get in touch with either myself, Nora Slavinsky at Arms Acres at the main number, 845-225-3400. You can reach out to me. My number is 347-684-4371, and we would be happy to get you that information. But it is going to be on Monday, November 6th from 2 to 4. So it's going to be an important day, and we hope that we will see you there.
And it's open to anybody.
It's an open house.
Okay.
And we have some guests coming, Michelle.
And we do have some guests. So we have the commissioners going to be there. We have the county executives going to be there. There are going to be some keynote speakers. I believe they're going to be speaking at about 3 o'clock. So we want to give people an opportunity to come, you know, meet with the staff, obviously get a sense of the space, learn a little bit more beyond what we're talking about today with respect to what we're doing. And then the keynote speakers will be there, and you can see them and meet them as well, which I think is good, especially with all of what's happening. It's important to know who these political people are.
That's right.
Back to drug crisis in our backyard. You know, she's done amazing work, Susan Solomon. So this is always a good thing, too. We're happy that they're going to be there. We're happy that we have that support.
Right. And I think now there's so much, you know, and could you reach Steve back there and get that flyer for a second?
Here.
You know, it's reversing the stigma. Should I hold it this way? Can you see? It's reversing the stigma. It's a movie. It was put out by Oasis, the Office of Alcohol and Substance Abuse, and it follows, I believe, 2 people and their struggle with this disease of addiction and their recovery. And it is October 16th from 7 to 9 at the City Center in White Plains. So please come, because that's a big stopping for people to get recovery, is the stigma about it. So please join us.
Willie, may I add something?
Sure, please
that I
do.
think is important.
Please, jump in.
The prescription of methadone and Suboxone, I think, is very important for a number of ways. The medication itself is vitally important for people, but in a methadone clinic or an OTP, as we offer it, people come in every day and get their methadone, and we also offer Suboxone on a daily basis as well. And so that structure of changing their lives, they have to be there, so like going to work.
Right.
That structure helps them as well. Structure for an addict is very helpful for helping them get over their addictions. And so that's part of the basis of this. And so then attending a group in addition to that. So that structure is a vital piece of their recovery.
I'm glad you brought that up, because it's about changing behaviors.
Yes,
it's about changing the lifestyle. It's about learning, relearning, or how they say live on life's terms, which is so abstract that, you know, a lot of it's abstract, but when you put in that context, it is. It's about, like your job, you get up, you wash your face, brush your teeth. This is your responsibility to go and be present and be accounted for.
Right. And
Talk, speak.
showing up is a big part of it. And so, you know, I think that that's another great thing, to engage people, you know, immediately and get them in their recovery process and allow them, you know, to be able to be a part of it and learn those new skills and work with somebody and have that individual counseling, that group counseling, and see that there are other people besides themselves who are striving for that recovery in their own life. And we hope that that's what they'll experience.
Now, may I address my staff?
Please.
We have 2 social workers and 2 CASECs. We have 2 nurses, highly competent people. And we have Dr. Rowe, and we have another physician, Dr. Klein, in addition to our front office staff. So we have a family of people who can provide services and welcoming to people. Lots of times, I think people who are addicted feel that they're not welcome.
Right.
We like to welcome them in. We want them to feel comfortable, not so comfortable that they can abuse themselves,
Right.
but we want to provide them with a kind of a welcoming treatment that they deserve. And my staff does a great job of that.
Oh, it's great. And families. You have family groups, or what do you do with families?
Well, families are part of recovery.
Right.
And so a part of what my case managers do is they involve families all the time. When we have an adolescent program as well, and that adolescent program, we see the adolescents, but in addition, we not just encourage, but we make it mandatory that the families come in at least once a week for a multiple family group. And so we don't want to, my background is a family therapist as well, so I believe I'm always pushing my staff to involve families more and more and more.
You have to.
Because otherwise nothing remains.
That's right. So tell us about your schedule for the adolescent program. What times is that? Days?
It runs 4 days a week, from 5 o'clock to 6 o'clock. It's one group for them. It's a co-ed group. And on Wednesdays, we have the multiple family group after the kids come. Right now, we have very few adolescents in it, and we're looking to more adolescents to come into the program. But in the past, we've had as many as 20. Right now, it's just less than a handful.
Why do you think that is? I'm just curious.
We don't really know. And we've reached out to the schools. We've reached out to as many organizations as we can, and we get lots of people who say, "Great, we'll send people to adolescents to your program," and we don't get the response. I'm not quite sure. I know the reasons why. I think things have changed in the school systems where the people who used to refer to us are no longer in that position any longer. That role does not exist in most of the schools. So I think that's one obstacle that we have not been able to overcome.
And I think also a lot of schools are keeping kids in school instead of sending them out. I don't know how productive that is, but we'll see, won't we? Time will tell.
Yes.
And I think, too, one of the things, having done a lot of work around adolescents in New York City and now more so in Westchester, there's a stigma around that, too. And, depending upon the school administrators, they have to walk a very fine line, working with families and what have you. And yet we all know that early intervention when we're talking about disease is essential in terms of helping to turn the tide. So it's so important that we all come out and we go to these films like Reversing the Stigma, and all of those types of things to be able to really band together to know that there's no shame.
I know.
And, we can look at the statistics and know that the earlier that someone starts using, the greater the likelihood is that they're going to become addicted. So it's not to be underestimated. Yeah, sure, kids experiment. We all know that. But to be cognizant of that. And again, to reach out to us if we could be of any assistance.
I think the legalization of marijuana has had a real dramatic effect on that. And I think that what worries me is that families don't realize how dangerous marijuana is for children under the age of, say, 25 or 28, when their brains are not fully developed. And that worries us a great deal.
And families don't realize that. I go out and I hear, well, it's only pot. I smoke pot, but it's different pot. It's stronger now, and we didn't know back then what it does to the brain, because you talk about changing the brain. Well, marijuana changes the brain, right?
Well, we know that it's poison for the adolescent brain. If somebody wants to make an adult decision later about marijuana, but I think we really need to hold the line as a society to make sure that our children and our adolescents are not using marijuana.
That's right. And that message has gotten lost. And like you said, the legalization, it's just muddled the waters. So much with our kids and our adults also. It really has. So we have to do as much work as possible. So it's great that you're having that open house. And hopefully maybe the schools will come, in this area. Will come and see what you're doing, and that it's nothing to be afraid of.
Right.
We do know that children bring pills to school. very often from their parents' medicine chests and cabinets.
That's right.
And so it's very important that parents make sure that those medicine chests and cabinets are kept well secured, and that there's nothing there that the children can end up abusing.
Because you know what, now that all the attention, and rightfully so, is on the opiates, parents say, well, my kid's not addicted to opiates, but they don't realize that marijuana, nicotine, and alcohol are the gateway drugs. I went out and I said that to a group of kids, and they laughed at me. Like, what, are you kidding me? I said, yeah, it is. It changes your brain, makes you more susceptible for the other drugs down the line. And that's the message that, like you said, we have to band together and give that message. And you doing the adolescent treatment and insisting on family work. What's the ages for the adolescents?
We've had as young as 14 and to 18.
To 18, okay. Well, you know what? It was great having you guys on. Thank you. A lot of information.
Well, thank you very much, Lynn.
Thank you.
It's our pleasure, really. Our pleasure. And tell them how to get in touch with you again, Michelle. Talk. Tell them.
Hi, everyone. Thank you. My name is Michele Hennessey. I'm the regional coordinator. Just reach out to me, 347-684-4371, or you can reach the main number, 845-225-3400, and ask for Nora Slavinsky. Thank you.
And your email?
Is mhennessy, HENNESSY, at Liberty, M as in Mary, G as in George, T as in Tom.com.